My name is Shandra and today I'm going to be doing a speech mech exam on my client, Lynette Douglas. She is a 35-year-old female. To begin, I'm going to sanitize my work area, and I'm going to wash my hands. All right. I'm going to begin. Well, first I'd like to start off. Do you have any concerns or anything you'd like to make me aware of? No? Okay. Then we will begin. First I'm going to look at just the overall structure and your facial muscles and see if you have symmetry or if anything seems a little off balance. So I'm just going to look at your jaw. And could you smile for me, please? Oh, thank you. Could you open your mouth very wide? Thank you. Can you raise your eyebrows? And can you close your eyes very tightly? Now he thinks you can open them. Okay, you can just relax for a minute. Everything looked very nice with that. All right, now I'm going to look at your lips. Okay. Could you give me another big smile, please? Oh, thank you. Now could you pucker out your lips like this? Now I want you to alternate between puckering and smiling, so like this. Could you do that a few times for me? Thank you. All right. Could you puff out your cheeks and hold your breath while I count to 5, please? 1, 2, 3, 4, 5. Okay, you can release. Okay, I'm going to have you repeat that again while I hold a mirror underneath your nose. This is just going to show me if you're able to hold your breath or if any air is escaping out of your nose. 1, 2, 3, 4, 5. Very good. Everything looked great with that. Okay. Now I'm going to have you alternate going ooh, ee, ooh, ee. Ooh, ee, ooh, ee, ooh, ee. Very nice. Okay. Now I'm going to look at your tongue. So for this, I'm going to put on my glove. First, I'll wash my hands again. Okay. I'm going to take a small drink of water. Would you like a drink?
Sure.
Okay. All right. First, I'm just going to have you open up your mouth and stick your tongue out for me, please. Looks good. Okay. Looks good. Can you just open up your mouth without sticking your tongue out? Thank you. Everything looks like nice color and shape. All right. I'm going to take one more look. I'm just going to use my flashlight. Can you open up real wide for me? Can you stick your tongue out and back in? Okay, thank you. Okay, now I'm going to have you stick your tongue out as far as you can for me, please. Okay, very good. Okay, now I'm going to have you stick your tongue out and hold it for at least a count of 5. Ready? 1, 2, 3, 4, and 5. Thank you. Okay, can you do that again without resting your tongue on your bottom lip? 1, 2, 3, 4, and 5. Very good. Thank you. Okay, now I'm going to have you stick your tongue out, and I'm going to have you take the tip of your tongue and point it up, and then down, and then to the right and the left, and then side to side as quick as you can, like that. Okay, I'm going to have you stick your tongue out and then retract it or pull it back into your mouth as quickly as you can. Very good. Could you do that one more time for me, please? Very good. Now I'm going to have you open up your mouth and then lift your tongue up to touch like the roof of your mouth so I can check out the underneath of your tongue, please. Looks very good. The area underneath your tongue is known as your frenulum, and yours looks very nice. Now I'm going to have you do some repetition tasks. Could you repeat la 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 la? La 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 la. Very nice. Now could you do ka 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 ka? Ka 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 ka. Very nice. Now could you do ka 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 la? Ka 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 la. Good. And could you do that one more time for me, please? The ka 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 la? Yes, please. Ka 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 la. Thank you. All right, now I'm going to take this plastic spoon and I'm going to gently press down on your tongue. And I want you to try to use your tongue and push back with some force against the spoon. I'm just testing the strength of your tongue. Okay. Very good. Very good. Okay. Now I'm going to look at your hard palate. Also, some people call it the roof of your mouth, just to check if there's any structural abnormalities or anything going on with the roof of your mouth. So if you could open your mouth up wide, please, and I'm going to use my flashlight again. Have you had any surgery in your mouth at all?
Yeah, I had my tonsils removed.
Oh, okay. That's good.
But nothing other than that.
Have you had anything?
Oh, I do have retainers.
Yes, I thought I noticed some retainers in there. Okay, great.
On both top and bottom.
Are those permanent or are those removable?
Permanent.
Thank you. Okay, now I'm going to look at your soft palate. I'm just going to look at the coloring and the structure and make sure everything looks okay there. I'm going to use my flashlight again. Oh, can you take a minute? Could you tip your head down just a little bit, please? And back up just a little. Very good, very good. Now we're just going to have a little conversation. I think I'm going to take my glove off. I think I'm done with the inside of your mouth examination. So while I'm taking that off and washing my hands, if you could just tell me about maybe some of your favorite things to do or things you're looking forward to doing this summer.
I'm anxious to go to the pool and spend some time outside playing on the sidewalk with sidewalk chalk with my daughter. Anything is better than the snow.
Yep, I agree. Okay, could you produce a prolonged ah for me, please? Ah. Now, could you do an just repeated like for me, please? Okay. Now I'm going to have you say a few words while I hold the mirror underneath your nose to check for nasal emission. So could you say dog,
Dog.
cat,
Cat.
horse,
Horse.
pig?
Pig.
Thank you. All right. Now I would like you to produce the sound ooh, as in the word boot, and alternate pinching your nose and then releasing your nose while you're producing the sound, please.
Ooh.
Great. Thank you. Okay, now I'm just going to, I'm going to take another little drink and then I'm going to check out your teeth and the structure and just the kind of your bite. So again, you mentioned that you have retainers?
Yeah.
Okay. And those are on the top and the bottom, you said, correct?
Yep.
Have you had any other dental work? I'm just going to ask you to open up your mouth, please. Good. And now can you bite down for me, please, on your back teeth? Very nice bite. Okay. Can you open up one more time? I'm going to use my flashlight and just kind of look around. Do you have any cavities at the moment that you're aware of?
A couple.
And you don't have any false teeth or anything like that, correct?
No.
Okay. Now we're going to move on to a few different speech tasks I'm going to have you do. So the first one I'm going to have you do is I'm going to have you say puh as many times as you can without taking a breath, without pausing, and as quickly as you can. So like this. Puh, 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 puh. Do you understand the instructions?
Mm-hmm.
Okay, just give me a minute, please, to get my timer set. And you may begin. Very good. Okay. And now I'm going to have you combine that with a puh with a tuh. So you're going to do puh-tuh, 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 puh. As quickly as you can, again, like before. And begin. I know, it can be a little tricky, huh? All right, do you need a little drink? Because the next one gets even trickier. For the last one, you're going to combine a pa, a ta, and a ka. So pataka, 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 pataka. As quickly as you can, okay? Just do the best you can.
Pataka, 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 pataka.
Very good, very good. Okay. We only have one final task I'm going to have you do. And I'm going to have you produce the S sound and hold it for as long as you can.
Okay.
Okay, just give me 1 second to get my stopwatch ready again. And begin when you're ready. Very good. And now I'm going to have you do the same thing with the Z sound. So, and again, just hold it for as long as you can. Okay, hang on. All right, begin when you're ready.